As a consultant, I felt that I could not do justice to all the children because all the children are not cooperative.
What is the biggest myth that parents still believe?
So whatever problem that is happening to the milk feed is temporary.
Welcome to today's episode of Childhood Smiles podcast, a space where we talk about parenting, health, and tiny habits that create big, healthy futures. Today, we have someone who has dedicated her life to the most delicate patients of all, children. She is an internationally awarded pediatric dentist and the heart behind Childhood Smiles. Dr. Debarchhana, welcome to the show.
Thank you so much. At the outset, I would like to thank you for this opportunity to give me a chance to talk about childhood smiles and about my journey. So thank you very much.
Doctor, before we begin, could you introduce yourself and take us through your journey and your medical background?
Sure. So I am a specialist pediatric dentist. I have done my master's in pediatric and preventive dentistry. Post my master's, I have also done my advanced training in lasers, in myofunctional orthodontics, in special healthcare dentistry, as well as airway dentistry. So now also I'm currently pursuing some higher education.
That's amazing. So, what made you choose pediatric dentistry when you could have gone into any other field in dentistry?
I chose pediatric dentistry because of children itself, because children are innocent, they are honest. Almost every day I learn something new from every child. So that's what keeps me going. And that is one of the major reasons that I chose pediatric dentistry.
Doctor, can you talk us through the journey of Childhood Smiles so far?
Sure. We started, it's almost going to be 5 years. Before that, I used to work as a consultant. As a consultant, I felt that I could not do justice to all the children because all the children are not cooperative. So many a times, it was not possible to deliver the right treatment as a consultant, what I felt. That is when the idea of building a specialist exclusive pediatric dental clinic came to my mind. And also I got the emotional support from my family, my father and my husband. So that is when I could gather the courage of building the clinic. Clinic only caters children from birth to 16 years of age. We have other specialist pediatric dentists also. We have specialist orthodontists also at the clinic. We have very good pediatric anesthesiologist also in our team. So basically, Childhood Smiles, I would like to call it as a children's dental home.
So, between genetics and lifestyle, which one do you think plays a bigger role in a child's dental problems?
So, child's dental problem can be various. So, it's a big umbrella actually. Under that, many concerns can come like cavities, alignment, then multiple habits. Genetics definitely plays an important role. It kind of puts the base. But what is more important is the lifestyle. So everyone will be susceptible to have certain condition. But how you maintain your lifestyle, how you do the preventive care is actually going to decide whether you're going to have the disease and to what level you're going to have it.
Many clinics treat children as small adults. Why do you think that approach fails for children?
So, children are not miniature adults for sure. For example, if a child walks into a dental clinic and the child has visited the clinic for the very first time, has some dental pain or something related, which is troubling the child, you cannot treat the child immediately, as you will do for an adult. Because for a child, what comes first is the fear. Because child is not scared of the treatment. Child is going to be scared of the, modality, how you're going to treat the child. So you cannot directly take the child and start treatment. So you cannot treat a small child in the same manner you are treating an adult.
How would you make the child feel in the first 30 seconds?
I want the child to feel safe. That is the most important aspect. That is what I feel.
Okay. So in the modern set, both the parents are working. How do you think they can realistically fit a dental care into their children's mind without, taking extra pressure of it?
Okay. So, first of all, we have to remove the word extra. We have to keep it as simple as possible.
Okay.
Like how we take bath and maintain overall general hygiene, everyday health hygiene. It is very similar to that. So, we have to consider dental hygiene as a part of our routine habit. Brushing twice is not a big deal at all if the parents themselves are doing. So when you do, your child is going to follow. So it will never look like an extra chore for sure. Coming to preventive care, dental visit for a healthy child once a year should be done. So that will solve maximum problem.
Has modern millennial style parenting changed how parents take care of their children or their dental or their child's dental health as compared to previous generations, for example, Generation X?
So I would not compare that, how parenting was in the earlier days and how it is now, because times have changed. We are all busy. Every parent is busy. That is okay. But yes, due to the busy and hectic schedule, sometimes what we have seen that the routine dental care, what is supposed to be, that is getting affected. And because of which we are seeing like increased number of dental problem in children these days.
Okay, so would you say that parents in the previous generations were more careful or more stringent about their children's dental health or like their health in general as compared to now?
No, nothing like that. The problem, as we were discussing about genetics and lifestyle. So in the lifestyle, whatever availability, the resources that is available these days are different from what was available earlier. Earlier, when we were children, that time the type of snacks, packaged food, the sugar consumption, all of that was not so much. It was not so prevalent. But now, if you see, everything is available in just a click.
Yeah.
10 minutes. So everything is available. Like the amount of packaged food consumption, sugar consumption, and snacking frequency, all that has increased a lot. So that actually brings the change more than the awareness of the parents. Parents are aware these days. Only thing is the environmental resource that is available.
What, according to you, are the 3 non-negotiables for parents these days to help their child to maintain a good dental hygiene?
So basic oral hygiene.
Okay.
2 times brushing is must.
Uh-huh.
Snacking frequency has to be taken care. It has to be in limitation. Routine dental checkups.
Okay. That's amazing. Do you think some common bad habits like thumb sucking, mouth breathing, actions like those can permanently damage a child's jaw or like their dental features?
Not permanently, but it can definitely alter the shape of the jaw, how it is developing, how the teeth alignment is going to be, how the face is looking. So definitely it has impact.
How does that impact a child's facial features while growing up? Could you throw some more light into it?
Sure.
Yeah.
For example, if a child is having prolonged thumb sucking habit, that means thumb sucking, which is very common in babies. We call it as non-nutritive sucking habit because they get emotional comfort from that. It is okay up to a certain age, 2-3 years of age. But beyond that, if it is continuing, because a child or a baby will have all the bones, even the jaw bones are very soft and moldable because there'll be pressure of the thumb in particular area. So that part of the jaw is going to grow further and it will have procline. That means forward appearance. So those things, if it is not taken care at the right time, it will definitely impact the entire facial appearance, then how the teeth is going to look. And because of that, there will be other consequences, like the mouth will be open. If the mouth is open, the child will develop secondary mouth breathing habit and they cannot bite properly. And because the teeth are in the front, whenever they fall, instead of the nose, the teeth is going to touch the floor first. So they will injure their teeth. They'll be prone to trauma, especially if they're into any contact sports. Anything, it will be different. So it has to be taken care at early age.
Do you think an unsupervised snacking habits between meals, can they lead to, bizarre dental problems?
True.
How is that?
Correct. Because in between major meals, if we are snacking more of packaged food, more of sugary food, more of sugary and sticky combination snacks, and we are not rinsing the mouth, whatever food we have taken or whatever snacks we have taken that is stuck to our teeth, that will definitely lead to cavities. First small cavities, then bigger cavities. And especially in kids, because they need supervision every time. Even if they snack, we have to plan their snacks well. So something which is freshly prepared and good alternative snacks from the packaged one. And sugar also. There are kids who love sweets and sugar. Same thing, like instead of having a chocolate, they can have a dry fruits laddu, which is prepared at home. But after that, cleaning the mouth, rinsing the mouth has to be supervised. So their snacks has to be planned, which time they want to have the snacks, that has to be planned. And the aftercare also has to be planned. Then it will be okay.
Parents these days say, is just one chocolate, what bad could it do? Is it like just one chocolate, or can it do much worse than we can think of?
So first of all, we have to stop blaming chocolate for dental cavities, because it is not the chocolate which is causing the dental cavity. It can be any snacks, because what bacteria needs to form acid and cause cavity is some form of sugar. So that sugar can come from any carbohydrate. It can be chocolate, it can be a laddu, it can be potato chips also. So if you say that my child is not eating chocolate, but he's eating biscuits and chips, it is going to be the same.
What are some habits that feel so natural, so, unproblematic to parents, but can actually lead to problems with their children's teeth?
So a very common habit, what we hear and what we see, sleep like a baby. That is, sleep with open mouth. That is considered to be very common. That is very common for parents. That is very common for whoever is seeing the baby or the child, but it is not natural and it is not correct, because when you're sleeping with open mouth posture, you're actually breathing through the mouth. That's actually going to a totally different direction, where you have disturbed sleep. Then you have abnormal jaw growth development. So that will have long-term impact in terms of airway health. That means how the child is breathing, how the child's adenoid tonsils are responding to that, how the child is in terms of allergies, cold, cough. Because of the mouth breathing, they will frequently fall ill. They will have frequent allergies. They will have less attention span, and they will not have sound sleep. So their entire lifestyle will be disturbed just because of mouth breathing. And it is also connected with overall dental health, oral health, and how the jaw is going to grow, how the teeth are going to be aligned. Everything is connected. So this is one very important aspect. This one habit seems to be very common and natural, but it is not. And this particular condition needs multiple assessment, not only by the pediatric dentist or a dentist who is certified for airway dentistry, but also by the ENT specialist. So whenever we see, because we also have to find out now why the child is breathing through the mouth. There are many reasons for that. Sometimes they'll be having tongue tie, sometimes they'll be actually having some anatomical deviations, like some constrictions will be there in the airway passage, some difficulties will be there. So we have to refer to an ENT specialist, find out that root cause, what is troubling them. Then anyone who is certified for airway dentistry. Also for myofunctional therapy, we help them, bringing those habits, normalizing those habits, and then correcting those, and then take care of the overall, jaw growth, alignment of the teeth, everything. and also to take care of the root cause. So mainly the medical fraternity, like the ENT surgeon, will help if there is any like anatomical concern or any allergy, anything is there. Then the allergy specialist helps. So it will be multiple consultation and multiple people's association, and then it is taken care. So mouth breathing is one such habit.
I've seen a lot of movies and TV shows from the West, and like in those things, I see that the children there have a habit of flossing.
Yes.
But here in India, like the flossing is not very common. Is flossing very important to maintain a dental hygiene?
Yes, it's very important, because what happens when we are brushing, we are only brushing the visible surface of the teeth. What is not visible is in between the teeth, the proximal surface. There, toothbrush cannot actually reach. So when we eat some even normal food also, and when we eat more sticky food, it will definitely go in and get stuck there. And that is when, if you're not flossing, it will start causing cavities. And if the child has gapping between the teeth, still okay, manageable. But if there is no gap, especially between the molars, if there are tight contacts between the molars and the molar and canine, then flossing is mandatory.
In your 5 years of experience at treating children at Childhood Smiles, has there been a patient who came with an ailment which could have been solved with a frequent or a consistent dental visit, which now requires a surgery or like a bigger treatment?
Yes, there are multiple scenarios, but if I try to recollect one, I happened to consult a child who was almost between the age of 3 and 4. And in that age group, he had lost all his milk teeth because of cavity.
Is that unnatural?
Absolutely unnatural.
Okay.
Because at the age of 3 and 4, by 3, many other kids are actually completing their primary dentition. That means they are still getting their milk teeth.
Okay.
So at that age, due to multiple cavities, full mouth cavities, the child had lost all the teeth. So there is no teeth for the child to eat. He has to only eat semi-solid or liquid. So that kind of broke my heart. Yes.
Could you explain what tongue ties are and how can they cause complications?
So tongue tie is actually a big subject. Tongue tie.
If you had to explain it to me like I am 5, how would you do it?
So in simple, words, it is a small tissue which is just present below the tongue, which makes the movement of the tongue difficult or restricted. Not all the time the tongue tie will have to be treated. Depending on what symptoms, like suppose a baby is born with the tongue tie and there is difficulty in latching. The baby is not able to feed. Breastfeeding is not possible. There is no weight gain. There are other difficulties for the baby. Then the lactation specialist helps. Then pediatrician helps. Then they refer to us. Since I'm a tongue tie specialist, so they do refer to us. We evaluate the tongue tie and we evaluate the whatever other histories that we get from the parents. And only on the basis of the requirement, we correct that. And suppose there is no problem at the infancy period, then it is not corrected. Then we wait when the child is trying to speak. Because tongue has a major role to, in the speech also.
Absolutely.
So sometimes it causes difficulty in speaking the word r, l, d. These words becomes little difficult to pronounce. There will be lack of clarity.
So a lisp can form because of tongue tie.
Yes, because of tongue tie. There also we try to help them with speech therapy, myofunctional therapy, and only if it is really needed, the tongue tie release is done. Sometimes we have seen kids who are unable to chew properly, again because of tongue tie, and swallow properly. There also we first help them with myofunctional therapy and multiple exercises with the tongue, and only if it is required later, we take care of that. And later, if all these problems are not there, tongue tie also has problem, it is kind of connected with the mouth breathing. Because when you're sleeping and you have tongue tie, usually your tongue will fall back. And when your tongue is falling back to your airway, It is kind of blocking your airway. So we get many complaints that, suddenly we get to hear the grinding sign, sound from the child. Parents will come and complain. So this teeth grinding is nothing but because of the mouth breathing, and which is again connected to the tongue tie. Because when your airway is blocked, suddenly your brain is sending signal, wake up. So that is when these muscles are activated and you're grinding. So then from the complaint, we go back and we check and we find tongue tie. So these things are also there. And because of mouth breathing, we discussed how the lifestyle is going to be affected.
Right.
The child will be having disturbed sleep. If you are having disturbed sleep, everything is going to fall apart. You're not the next morning, you are not fresh. And more cold, cough, allergy. Other than the dental problems are very minor part, because having a healthy life is very, very important. And it also has impact on the jaw growth and the alignment of the teeth. And many times we see many molar teeth cavities because the tongue tie will have restricted movement. So tongue is actually your universal toothbrush. So it moves all around and cleans if there is any food lodgement is there. Now, what happens if the movement of the tongue is restricted? The child cannot actually use it for cleansing, right? So that is when food lodgement, and typically we will see the cavities in the molar teeth. So there are various problems with it, but the correction and treatment only on the basis of need, thorough evaluation, and what symptoms are there.
Not just children. At times, parents are also scared that getting braces from the wrong place might just, build more problems for a child's jaw than to solve it. How does Childhood Smiles as a clinic take care of these myths or these underconfident parents or skeptical parents?
So basically, when we talk about teeth alignment, jaw growth, or abnormal jaw growth, we have to find out the root cause first. Whatever malalignment happens, it does not happen without any reason. There must be some driving force behind it. So it is very important to treat the condition based upon the etiology. You need to know what has caused, this condition. So when you know the root cause, for example, a child has open bite, the mouth is open, tongue is coming out, what we call tongue crust. We cannot directly jump and do the alignment. We have to break the habit, correct the habit, and build some good muscular strength specifically for the tongue, what we call myofunctional exercise, and then do the alignment. And when you do correction for the etiology and then take care of the the concern, whatever correction is done, it will be more stable. The retention also will be more. So it is very important to do a thorough analysis. That's what we do. We do not do any shortcuts. If an X-ray is needed, we will definitely have to take the X-ray. If proper consultation is needed with the orthodontist, we will make the child meet the orthodontist, and also parents to meet the orthodontist, take the opinion. And then with the X-ray, with whatever pictures we have, whatever history we have collected, we discuss with the parents. We make them understand. If the child has to wait, we inform them, yes, we will wait. If we immediately have to take care, we inform that yes. So everything is very transparent and everything is evidence-based. Nothing just, because I want to start braces, nothing like that. Because what we work for is, for the child's benefit. From everything that we are doing as a team. Child, parent and the doctor. We are a team. So in that team, who has to be the winner? The child. So when we want the best for the child, we will do everything which is evidence-based and ethical. That is what we follow.
How do you think pediatric dentistry has evolved throughout these years? What was happening 10 years ago? Is it still happening today, or has it changed now? Because as a child, I was mortified going to a dentist, and I hope that has changed now.
Yes, that has changed. There is actually a lot of awareness that has been created, and not only from the parents' perspective, also from the dental perspective. Earlier, a general dentist also would treat a pediatric patient. But it's very different when a general dentist is treating a child and a trained pediatric dentist is treating a child. Because during our master's programs, all the 3 years, what we are doing is treating children. So treating children is not about treatment or the treatment technique. It is about patience, giving them time, understanding the child, and empathy. If you have mastered these things, great. So there are a lot of centers opening all over the country. So I'm very happy that in India we are actually evolving in terms of pediatric dentistry, which is a very good thing. The more exclusive pediatric dental practices will be there, there will be more awareness. Parents will be more aware, which is happening these days. And who will benefit from all this? The child. The child will never be neglected further.
What do you think makes childhood smiles stand apart?
So I believe that the design that we have created at Childhood Smiles, it's very welcoming for a child. It does not feel like a clinic or dental care center. It feels like home. Like there's a play area, there's a small reading library area for the kids. Apart from that, we have theme-based operatories. So we have a space themed operatory. That is basically for the children with special healthcare need, because there we work with some principle called Snozelin concept, where the lights are dim. Only mild blue light will be there, because child with special healthcare need will not respond good to the bright light. And we have jungle themed room. Then we have ocean themed room, and we also use laughing gas, which is a modern technology for treating pediatric dental patients. And we have advanced sedation machines also. So the motto of Childhood Smiles is painless dental treatment.
5 years from now on, where do you see childhood smiles?
So 5 years from now, I want Childhood Smiles to be a trusted dental home where, as I said, the babies, the infants, the kids that I'm seeing right now, they still have the same trust when they hear the name Childhood Smiles, and they're excited to come back.
So, as we both know that working with children can get overwhelming at times, So, was there ever a moment in your career when you felt like giving up because you were mentally or emotionally overstimulated because of dealing with children?
No, never. As I said, I chose pediatric dentistry because I love children. And I genuinely love children. There are days when I'm really upset. Like I walk into the clinic, I am upset. Something has happened back home. As soon as I enter the clinic and I see a child, I'm happy. My mood just changes. So that's how, children have impacted my life. Yes, some days are difficult, some days are hard, but I have never given up. If I'm emotionally overwhelmed, I just cry, or I speak to a friend or family, but I have never given up, and I don't have the intent of giving up in the future as well.
What is the biggest myth that parents still believe today?
When it comes to dental care, I think most of the parents still have that myth that, all the milk teeth is going to fall. So whatever problem that is happening to the milk teeth is temporary.
Okay.
Yes, the milk teeth is temporary, but it is forming the base for the permanent teeth to erupt. So actually what I call the milk teeth is mother, and the permanent teeth is which is going to erupt as the baby. So how you take care of the mother, the baby is going to come, as healthy as possible. So milk teeth not only help in chewing, they also form the base for the permanent teeth to erupt. They help the jaw to grow properly. They also help to, how the child is speaking, how the child is swallowing. All that is, connected. So it is not only that, the teeth is going to fall and whatever problem is there for the milk teeth is can be ignored. If we are ignoring the milk teeth problems, whether it is cavities, alignment, or anything in related to the milk teeth, we will definitely have to pay a price for it. Not immediately, because all these problems will not happen overnight. It will happen over a period of time.
Got it. Thank you so much, Dr. Debarchhana, for taking out time and giving us such beautiful insights.
Looking forward to knowing more in the next coming episode. Thank you.